all your questions are my questions, and I am ready to deal with those questions. Jeszcze raz dziękuję bardzo. To było bardzo miło spotkać, porozmawiać.
Society is complex. Our problems are very complex. Our answers will be complex, but we can only find those answers together with 500 million Europeans.
Let's work together. I'm here to learn from you. I'm looking forward to discuss with you. I would like to hear what you expect from the future of Europe and what you are expecting me to do for you.
25 years ago, it was hard to believe that we'll be on this stage together.
I'm here to listen to you very carefully, and I would like to hear about your opinion, how we have to develop the European Union. I'm ready to take your questions.
How can we make Europe more transparent?
We need more content, we need to talk, we need to listen. We need to listen to your concerns and change the system on the basis of your concern.
Atskiras, jo. Ausinė vertimai eina į šitą ausį.
Dzień dobry, witam Państwa serdecznie w Centrum Kulturalno-Kongresowym Jordanki w Toruniu. Za chwilę, za parę minut rozpoczniemy debatę na temat zdrowia z komisarzem Unii Europejskiej do spraw zdrowia i bezpieczeństwa żywności, panem Vytenisem Andriukaitisem. Wcześniej jeszcze kilka organizacyjnych informacji dla Państwa i cieszę się przede wszystkim, że Państwo przybyli tak licznie. Z informacji, które posiadam, wiem, że nie tylko torunianie dzisiaj dopisali tutaj w Jordankach. Wiem, że przyjechali Państwo także z Białegostoku, Inowrocławia, Katowic, Kołobrzegu, Opola, Piotrkowa Trybunalskiego, Wrocławia, a także z wielu innych miejscowości z całej Polski. Bardzo się cieszymy, dziękujemy bardzo i cieszę się, ale się nie dziwię jednocześnie, bo temat jest ważny, nośny, istotny dla każdego z nas, to nasze zdrowie. Pan komisarz Andriukaitis, a także marszałek województwa kujawsko-pomorskiego będą za chwilę odpowiadać na Państwa pytania. Chcemy rozmawiać o tym, co Państwa boli, co jest ważne, co cieszy, co się zmieniło od czasu, kiedy Polska jest w Unii Europejskiej, czy zmieniło się na lepsze, czy Państwo są z tego zadowoleni, czego jeszcze więcej oczekują. Unia Europejska podejmuje wiele działań na rzecz ochrony naszego zdrowia. To jest promowanie zarówno zdrowych postaw, zdrowej żywności, dostępności do służby zdrowia coraz lepszej, oby tak było, a także inwestycje. Są to inwestycje i to jest bardzo ważne w służbę zdrowia, co Państwo torunianie zwłaszcza wiedzą doskonale, bo tutaj rośnie na Państwa oczach od niedawna szpital, który jest i budowany częściowo, rozbudowywany i modernizowany i który po zakończeniu inwestycji ma być jedną z najnowocześniejszych placówek w Polsce. I głównie o takich inwestycjach właśnie chcemy rozmawiać, ale pan komisarz Andriukaitis jest otwarty na wszelkie pytania od Państwa i na pewno nie będzie uchylał się od odpowiedzi. Praktyczne informacje. Pan komisarz Andriukaitis mówi doskonale po polsku, jednak w czasie debaty będzie mówił w języku angielskim, dlatego aby ułatwić Państwu tę komunikację, przygotowaliśmy dla wszystkich z Państwa specjalne zestawy słuchawkowe, które mogli Państwo otrzymać przy wejściu. I to jest ten moment teraz, żeby upewnić się, że wszyscy Państwo, którzy potrzebują takich zestawów, mają je ze sobą. Jeśli nie, to jeszcze można sięgnąć po nie teraz właśnie, żeby później już nie zakłócać debaty. Na kanale numer 1 będzie dostępne tłumaczenie w języku polskim, na kanale numer 2 w języku angielskim. Będą Państwo mogli zadawać pytania w 2 turach, tutaj z sali, ale także, ponieważ transmisja jest prowadzona w internecie na profilu facebookowym Komisji Europejskiej w Polsce, na kanale YouTube, a także na stronie internetowej Komisji i będą mogli internauci zadawać także pytania, komentować tę debatę. Tutaj przydatny hashtag EU Dialogues, on jest widoczny także na monitorach. Hashtag EU Dialogues, proszę korzystać z tego hashtagu. Wi-Fi jest dostępne także w sali. Przepraszam, ogromna jeszcze prośba o wyłączenie telefonów komórkowych, tak by nie zakłócały nam dyskusji i już za chwilę zaczynamy debatę na temat zdrowia z cyklu Dialog Europejski. Panie i Panowie, witam Państwa serdecznie w Centrum Konferencyjno-Kulturalnym Jordanki w Toruniu na debacie z cyklu Dialog Europejski, Dialog Obywatelski poświęconej służbie zdrowia. I witam gości naszej debaty. To pan komisarz Unii Europejskiej do spraw zdrowia i bezpieczeństwa żywności, pan Vytenis Andriukaitis. Proszę się pokazać, panie komisarzu.
No co ja mogę?
Marszałek województwa kujawsko-pomorskiego, pan Piotr Całbecki. Panie marszałku. Prezydent Torunia, pan Michał Zaleski. Panie prezydencie. I zastępca dyrektora przedstawicielstwa Unii Europejskiej w Polsce, pani Marzena Gus-Weter. Witam serdecznie panią dyrektor. Ja nazywam się Dorota Wysocka-Sznep, kłaniam się Państwu nisko i zachęcam do aktywnej debaty na temat zdrowia. Wierzę, że będą Państwo aktywni, bo temat jest bardzo gorący, nośny, ważny. Do aktywności zachęcam też internautów. Debatę można obserwować na Facebooku, na kanale YouTube, na stronie przedstawicielstwa Komisji Europejskiej w Polsce, a także komentować ją, zadawać pytania poprzez Twitter, poprzez Facebook, hashtag EU Dialogues, tutaj jest widoczny na monitorach, hashtag EU Dialogues. Wiemy, że zdrowie to jest to, co mamy najcenniejsze i chcielibyśmy, by państwo polskie i Unia Europejska również dbały o nasze zdrowie jak najlepiej potrafią, lepiej niż teraz. Chcemy być może wskazywać kierunki i pokazywać nasze oczekiwania i to jest ten moment, żeby panu komisarzowi powiedzieć, co nas boli, czego oczekujemy i co nas cieszy też, bo nie mam wątpliwości, że odkąd Polska jest w Unii Europejskiej, to te standardy
we find satisfactory because there is no doubt that since Poland has joined the EU, the health standards have improved. Health also means investment in healthcare, and it's a part of a broader investment plan for Europe. Let us begin.
Chcesz wiedzieć, kto może ubiegać się o środki w ramach planu inwestycyjnego dla Europy? Podstawowe grupy, które mogą ubiegać się o środki, to
small and medium enterprises, companies that involved in research, energy, digital technology, transportation, environment, infrastructure and innovation. All those groups can take part in a real investment ball whose main aim is to restore economic growth in Europe and at the same time help people go back to work. Support is provided in different forms. There may be loans, credit, or equity investment. Remember that the investment plan is a response of the European Commission to the financial crisis in many countries of the European Union. Support a project or invest. How? Hashtag InvestEU. More information on europe.eu/investeu.
Panie i panowie, zapraszam na
Ladies
scenę
and
prezydenta
gentlemen,
Torunia, pana
now I'd like to invite to the stage Mr. Michał Zaleski, the mayor of Toruń. Mr. President, Mayor, the floor is yours.
Panie i panowie,
Ladies and gentlemen, with Polish hospitality in this beautiful place, we welcome the EU Commissioner for Health and Food Safety, Mr. Vytenis, Andriukaitis, and the representatives of the European Commission in Poland. We're doing this in Toruń, one of the most famous and the most popular cities in Poland that has always been a part of Europe. To myself and to our guests, we want to show Toruń as the town of Mikołaj Kopernik, who has not only been a scholar of all times, the best of all times, but also an educated doctor. We have a medieval old town here, which attracts about 2 million people from all over the country and all over the world to our city. And for 20 years, the area of the old town is listed on the World Heritage List of UNESCO. Toruń is also a university town, a town of young people. And if we're talking about the healthcare investment plan for Europe, we're thinking about young people. And that is how we should look at the construction of the General Hospital in Toruń, an extension of this hospital, which is the first such big project supported from the European Fund of Strategic Investment. But we also have a very good city hospital, a specialist hospital named after Mikołaj Kopernik, to which we have recently granted a very, very modern surgical robot for contactless and non-invasive surgeries. Very modern piece of equipment. Toruń is also a municipality which signed agreements for subsidizing 227 projects between 2004 and today, funded from EU funds and Norwegian grants. This support exceeded 650 million Polish zlotys. In Polish conditions and in reference to the size of Toruń, that has 200,000 inhabitants, this is an enormous scale, and that really gives us a change for civilization development. An important part of that are initiatives in healthcare. Polish most famous epic poem, Pan Tadeusz, has at the very beginning a praise for two elements most important for us: health and our homeland. In fact, the first edition of this epic poem was first published in Toruń. Lithuania, my homeland, you are like health for us. How much you should care for it, you only realize once you lose it. So this is something I dedicate to the Commissioner, who is a Lithuanian, but also to all citizens of Europe, so that you can always enjoy your health and you can always love your homeland. Thank you very much. Michał Zaleski, the mayor of Toruń, thank you very much. So Lithuania, my homeland. The commissioner is from Lithuania, so I think this is a very apt comment. Now, I'd like to invite Marzena Gus-Wetter, the Deputy Director of the Representation of the European Commission here in Poland. Ms. Gus-Wetter, the floor is yours. Ladies and gentlemen, dear guests, I wanted to welcome you very warmly on my own behalf and on behalf of the entire team of the representation of European Commission in Poland, and also on behalf of my colleagues Piotr and Rafał Rudnicki, who have been preparing today's event from Warsaw and from Brussels together with their teams. I want to thank you very much for coming here. European Dialogues is a response of the European Union to the growing criticism that the Brussels elite do not listen to citizens enough, that they respond too late to things that are of concern to the citizens, and this is an attempt to make up. Since last year, the European Commission has strengthened its dialogue with the citizens. This year, we had more than 60 visits of commissioners, EU commissioners in different EU member states. Altogether, we had 100 civil dialogues organized. It's very important for us that we can meet you, and what you tell us, what you ask, this is not something that will disappear in some black hole. This is something that is taken down diligently by us, and we will take it forward. The European dialogues are part of a bigger debate about the future of the European Union. The European Commission this year has presented the so-called White Book, containing different scenarios for the development of the European Union. We know that we have different debates, discussions underway. Some want more Europe, some want less Europe, others want to have the Europe of two speeds, yet others think that it would be the same if we just did business as usual. It is true that there are a lot of challenges that we will have to face as regards Toruń, and the reason why we're having this civil dialogue here in this particular place. This is to show the recognition of the European Commission for this region, for this city, for its representatives, for people who live here, who work here, to thank them for doing so well in using the European funding, and also in recognition of the fact that they are bold enough to use the European funding, structural funding, as well as the grants under the so-called Juncker's plan. So we can say that probably in 2 years, many of you will be able to use this big, fantastic hospital that will not only be a modernized hospital, but it will be just a big medical town, if you like, serving the entire region. Thank you very much for your attention, and I wish you a fruitful debate. Ms. Marzena Guzweter, thank you very much. And now I'd like to give the floor to the Commissioner for Health and Food Safety, Mr. Vytenis Andriukaitis. Commissioner, the floor is yours. Ladies and gentlemen, thank you very much. I'm really glad that I can be here and that I can talk to you. My Polish is not very good. I'm from Lithuania, from Vilnius, so I can speak some Polish, but I know Lithuania, my homeland. You are like health. As a doctor, I know how difficult it is when your health is not good, when you don't have your health anymore.
Today, and even more to see so many of you. This is a proof that we are building our home together. It's very important to understand. We are building our home together. Our home in Toruń, in Vilnius, in Brussels, in Dublin, everywhere. This European project has many aspects, European Union project. Of course, it is a project about our quality of life. When I see you, I know that you all are thinking about your everyday quality of life. It's one. Second, European Union is a project about peace, no doubt. About democracy, no doubt. About human rights, no doubt. What does it mean, European Union? It means that I don't know what does it mean, Brussels. I don't know what does it mean, bureaucracy. I know that we are people who believe in those values. And it is project, or European Union's project, it works for people. Please look in such very important slide about investment in Poland. The hospital that I visited this morning is a great example of how European Union is work for all of us. We have 13 projects funded by the EU investment plan in area of health. We invest in health care. Why? Because we foster possibilities to achieve better quality of life of all of us. We foster innovation and research, bringing new treatments, medicines, and devices to patients. We push for European Union to use e-health tools to help patients to monitor their health status. And we also help member states to establish European reference networks, joining 313 hospitals and 940 units in those hospitals around EU, treating rare diseases, low prevalent diseases, and very complex diseases. And here we are doing excellent job today, building new hospital in Toruń. And of course, but when I am speaking about hospitals and about health, I know very well that Piotr will speak about health as investment, and it is true. Health is the biggest investment. And when we are using word health, please look at this map. Can you imagine that yellow color? Very green, yellow, and of course, then very gray. It is about life expectancy. Can you imagine differences between countries? And some countries have very high level of life expectancy, and Poland is not in very green. I know that your regional leader and doctor and chief of hospital likes green color very much. And I wish you to have to change this color. But when we are looking at those slides, please show a little bit. It is about smoking. Next one. It's about alcohol. And it is about our possibilities to discuss what does it mean to be healthy. Younger generation knows very well a healthy lifestyle. You know how it looks to be healthy, to be cool, using different facilities, healthy nutrition, physical activities, and of course also to be psychologically very well. Older generation knows very well they need to have more care, more cure, more medicines to help them to stay more healthy. And I wish you today discuss those issues together, raise your questions. And of course, because we have only one way, to listen each other and then to understand what does it mean, European Union investing in health, because our topic is let's invest in health. Thank you.
Pan Vytenis, Andriukaitis, komisarz Unii Europejskiej do spraw zdrowia i bezpieczeństwa żywności nie wypuszcza.
Commissioner for Health and Food Safety. Commissioner, please stay. Please don't go.
Here.
And now let me invite the Marshal of Kujawsko-Pomorskie Voivodeship, Mr. Piotr Całbecki. Commissioner, Mayor, representatives of the European Commission and the European Investment Bank, ladies and gentlemen, let me express my joy at the visit of the Commissioner, that the Commissioner wanted to come to our region and run this public dialogue, civil dialogue here about the current condition of the European Union and the future of the European Union. This dialogue is taking place in very specific times, difficult but interesting. 60 years from adopting the Treaty of Rome, I think it's worth asking yourself a question, Commissioner, or perhaps ask Mr. Schuman, the late Mr. Schuman, where are we now? Has the time when the founders of the European Union, Schuman, Adenauer, Monnet, who wanted to get rid of war, get rid of quarrels that used to divide Europe, are we now living in the times that are better, in the times that have fulfilled our expectations? I am really prepared to bet on that yes, the times have changed to the better. Let us not let ourselves be persuaded that Europe is heading for disaster, that the European civilization, ancient, Christian, is just a history. It's not true. Indeed, not everything was a success over those 60 years. Perhaps in the Balkans, we should have acted differently. We should have intervened earlier in order to avoid the tragedy. But generally, Europe is a space that has avoided another disaster after the Second World War. The peaceful transformation from Iron Curtain and transferred of our Eastern European countries to Western civilization area, these are really great things that have been happening and that we were witnessing. The fact that the European Commission today from Brussels, through its highest representatives, commissioners, sees the need to talk to us, to talk to you, this only means that it will be even better. This voice is very important. We will be having this discussion today about health, but earlier with the Commissioner when we were visiting the hospital and we had an opportunity to talk face-to-face briefly, we arrived in one conclusion, that health is not just spending money. It's not just a cost. This is great investment in the future of the European people, including Poland, an investment project in Toruń, but also many others. It's just a beginning. We will be living in Europe where you and myself and our children will have the guarantee of the same healthcare services wherever you are in Europe, in Poland, in Lithuania, in Spain. I would really like to live in such Europe, and I would like to live to see such Europe come true. Mr. Piotr Całbecki, Marshal of the Kuyavian-Pomeranian Voivodeship. Thank you. In a minute, we will begin the main part of our debate, that is questions from the audience. But before we do that, we want to ask you one question. The question, do you have the feeling that your voice is being heard at the European level? We won't be accounting exactly your answers. We want to get an estimate to see what your feeling is about this. So I would like you to vote by raising hands. First, the answer yes. So, do you have a feeling that your voice is being heard at the European level? Who would answer yes? Please raise your hands. Thank you. And who would answer no? Thank you. This is a rather gloomy answer, because most of you don't believe that your voice is heard at the European level. But I hope that after today's dialogue, this proportion will change, and more of you will be convinced that it is really being heard. And now let's begin questions from the audience. Please raise your hand if you want to ask a question. On both sides of the room, there are ladies with microphones who will approach you, and you will be able to use the mic. It's going to be the first. It's always the most difficult thing to be the first. Okay, the gentleman at the back. And please be brief in formulating your questions. I do understand it's just that you are shy at the beginning. It's just the first steps. But please to be precise and concise. I represent the Assembly of the Voivodeship. The question to Commissioner, are you siding with the producers of pork or siding with those who want to reduce the colon cancer prevalence? You know what it's all about. It's about the additives that make our food look very good but not very healthy. So what is your answer to that? This is something that we are worried about, the quality of the food we eat. I'm sure we will have more questions.
Thank you very much indeed. Of course, I am with those who are worried about health, because I am a medical doctor. I never produced pork in my life. I only eat pork, like you. But if to be serious, yes, food safety is main concern in my portfolio. And of course, problems with different additives which are allowed to use in our meat are always under my control, and we have very thorough scientific assessment of all additives which are on the list of European Union additives which industry can use in their food production. But of course, for all of us, it is very important to have more fresh, more healthy food. And why we have a long program to reduce salt, sugar, trans fats, of course, reformulate food, reduce chain of food production, to push very much industry, not only those who are growing pork, but industry generally, and to provide to people more fresh and more healthy food. Of course, it's a very difficult job, but we are doing this job introducing rules, introducing assessment mechanisms, allowing industry to follow reformulation agenda. Industry signed today a voluntary declaration about possibilities, reduce different ingredients, additives in the food. And today you have in Toruń Nestle, I know very well, but Nestle signed voluntary agreement that they are ready to reduce sugar in their production more than 10% till 2030. And we have a lot of instruments pushing industry to provide more healthy and more fresh food.
Bardzo dziękuję, panie komisarzu. Wiem, że już są kolejne osoby, które zgłaszają
Thank you very much, Commissioner. I know we have further questions from the audience. I also want to encourage you, because I want to remind everyone that the internet users are watching us on Facebook, on YouTube, and they can also ask questions that we will read here in the room, and we will pass them on to the Commissioner. Hashtag dialogue EU dialogues. So you can either make a comment or ask a question. So, what questions do we have? Okay, so let us now look at questions from the internet. Marcin, how can we manage Polish healthcare services so that the emergency service workers didn't have to leave Poland because of very poor pay that they get? So how, Commissioner, how Polish healthcare services should be managed so as not to make Polish emergency services providers to leave Poland because of the very poor health?
Bardzo ważne pytanie.
A question from Marcin, yes, very important question.
Thank you, Marcin. This question is everywhere. Last week I was in Dublin. Few weeks ago I was in Spain. I was in Lithuania, in Romania. Everywhere is question about our wages, which are paid to medical doctors and nurses. Of course, situation is very difficult in all countries. But if you compare wages in UK and in Poland, of course, in UK, those wages are a little bit higher. And then you see social dumping when a lot of doctors and nurses are going into the richest countries because of very low level of salary. And it is everywhere. How to provide more incentives and how to encourage governments and societies to understand that we need to spend more public spendings dedicated to health care system. This question for all of us, for me, for you, for all of us here. Of course, Commission presented very brilliant document. We started in 2014 to discuss those issues, and we presented to all 27 member states big study showing how can you use instruments, recruiting healthcare staff in your country, recruitment, retainment, and possibilities to provide different incentives to support healthcare doctors and nurses to be in their countries and to help their people to achieve treatment. It was our job, and we presented those studies, but I know very well, and I am Vytenis Povilas. In Polish, I am Pavel. You are Piotr. Pavel and Piotr. And we know very well how it is difficult to solve those issues immediately, but we need to discuss this openly in our societies, in Poland, in Lithuania, in Romania, in Bulgaria, because everywhere this question is on the table today, now. How to change our taxation system, how to provide more public spendings into public sector, and how to raise questions about levels of wages. It is, of course, absolutely. Thank you. Very, very excellent question. And from my point of view, please read this from Commission side of our studies in which we have a lot of instruments. But those instruments must be introduced with national governments, with national parliaments, with regional governments, of course, with local communities, with all of us, because I am one of yours. But I know very well that this is very, very complex issue and very complex question. And only one way to use those instruments and analyze and to see how to really address those issues. But I see a lot of possibilities to move in such direction. And we have, so today, very high-level working group which is dealing with those questions every month. I will present next step about healthcare workforce planning and training issues. Today we have lack of doctors. In EU we lack 4 million doctors and 13 million nurses. Can you imagine which difficulties will be in the 5 years?
Bardzo dziękuję, panie komisarzu, i mam nadzieję, że zobaczę teraz.
Thank you very much, Commissioner, and I hope we will now have a lot of hands raised with questions. As it was just a minute ago when I asked the question whether you feel your voice is heard at the European level, because if I don't see all those many hands right now, it may mean that your voice is not being heard in Europe because you don't try to express yourself, to say what your voice is, what your opinion is. So please try to use this opportunity. Good morning. Piotr Trybunalski, Iwona Bośniak.
Source of financing of healthcare. I mean, how do you see the future, whether the healthcare should be financed from private sources, private resources, or it should be state-run? Because there's a lot of discussion whether the healthcare should be public at all, and that if what's made private, it would be better for the patients. What is your view, and what is the future for healthcare? More in private sector or more in state sector?
Bardzo dziękuję za to pytanie, panie komisarzu.
My personal view is, sorry to say, because I'm one of yours, in public sector. My personal view. Especially when you're looking at specialized medicine, it's very a high price. It will be very difficult. It will be very disaster to see only private sector. Of course, when you look at, we have today 28 member states. Of course, UK will go out of us. And then we will 27. We have 27 different healthcare systems. No one is the same. No one. Generally, we have 5 models. Bismarck model, Beveridge model, Scandinavian countries model, Mediterranean countries model, and our Central and Eastern European models. Generally, they all have their good sides and bad sides. No one is perfect. No one is perfect. But if you ask me, I will be more in favor to support public sector based on solidarity. It means that I support discussions in society to keep eyes on taxation issues. Because, you know, we need to have taxation system which allows us to help all of us to achieve healthcare. And of course, also, I know very well that we have different sectors. Private sector in primary care, today you have a lot of private sectors. Okay, in primary care you see possibilities. But if you look at secondary level, tertiary level, hospital, absolutely, I see more opportunities to develop public sector. And of course, public-private partnership is here also good opportunity to develop it. But it is not confrontation between different models, because those models have their own areas in which they are quite good and areas in which they are absolutely bad. And to create synergy between big hospitals and clusters of hospitals which are in hands of public sector, and then to create synergy with private sector in primary care, maybe is the answer in Poland.
Bardzo dziękuję, panie komisarzu. Panie marszałku, chciałby pan coś dodać jeszcze do tej
Marshal, would you like to supplement this answer from the Polish perspective? In Poland, we have roughly 1/3 of the healthcare which is financed from private sources and 2/3 public healthcare. This structure is, I would say, similar in most European countries. In OECD, only in the US, it's a 50-50 split between public and private. Is this an indicator that we need to take into account in improving access to healthcare services? I believe yes, private healthcare sector is needed in order to create competition for the public sector. However, we need to be mindful also of the fact that healthcare is founded on the principle of solidarity, solidarity among the whole community. There are those who will never fall ill in their life and pay contributions to healthcare, and those who will incur diseases that they could never finance from the private funds. So I agree that economics here have to take a second place. So who would like to ask a question at this point in time? We invite your questions. Please stand up. Barbara Rojek, Toruń. I would like to ask, how does the European Union handle a contradiction between, on the one hand, healthcare protection and the agreement to euthanasia in some countries and abortion, which is allowed in other countries? How you can reconcile healthcare with euthanasia and abortion? Can you answer this question, Commissioner?
Thank you. A very difficult question. And I know that it's a question which divides societies and very, in very confrontation atmosphere. From ethical point of view, I know what does it mean word euthanasia. I know it's a very difficult one. And of course, as a medical doctor, I know that it's not up to medical society to discuss those issues because it's religious, philosophical, cultural, and more factors together. Society must be very open and discuss because sometimes in some very narrow situations you see so terrible, painful picture then patient has no chance to stay alive. And then it's so painful to see that. I am a surgeon, and I know very well from the beginning we have difficult decision to not to continue our intensive care and to decide that this patient must be dead and his kids must be done to transplantation. What is about? Can you imagine how it's difficult? It's not to discuss, in some, political way. It's a very sensitive question. Speaking about human rights, speaking about reproductive rights. I know that in Poland you have prohibition on abortion. I am not in favor to support prohibition because it is very complex one issue with human rights. Of course, I know very well that we need to have all picture of reproductive health of society, of women, and how to help women to avoid situation, how to provide more instruments to keep eyes on possibilities to have good health, because every intervention also then creates a lot of problems with fertility and different questions. But to go into law and to divide society and to discuss those issues and then to see that some are playing political game, it's not up to me. But human rights must be respected. Constitutional human rights must be respected in all complexity of issues. And of course, I know that it is a religious question, it is question of science, it is question of deep debates. But I am more than happy to have those societies who are very sensitive to those questions, not creating debates about law and so on. We have a lot of opportunities to avoid possibilities to do abortions, but we can provide all reproductive health instruments to help women. And of course also, but sometimes you know very well the situation is very difficult. But all prohibitions, not from my point of view, very sensitive question. Personally, I am not in favor to support regulation at law level. It's much better to regulate those levels of our professional side, of our medical societies, of our discussions. We had a lot of opportunities to solve those questions without dividing society and without creating problems with human rights.
Bardzo dziękuję, panie komisarzu. Teraz pytanie natury mniej filozoficznej, bardziej praktycznej. Nasz hashtag EU Dialogues jest bardzo aktywny. Pytanie od pani Anny. Czy mogę wyjechać na operację do innego kraju Unii Europejskiej, żeby ominąć gigantyczne kolejki w polskich szpitalach? Czy moje ubezpieczenie to pokryje? Pokryje, panie komisarzu?
Yes, Anna, you are right. You have the right to go to another country today, because cross-border health care directive is in place. And we know very well, I will have discussions with Polish government about implementation issues of such health care cross-border directive. Because today, we know very well that in your regulation you have a lot of administrative burdens and of course a lack of money dedicated to those issues, speaking about reimbursement. But you all have today right to go to your government, to visit your national contact point, to receive information, and then to discuss with your doctors and your government in which country can help you to achieve surgical intervention. Because some countries have very long waiting lists, some countries have not. And today, cross-border healthcare directive open new opportunities for all of us, from Lithuanians, Polish, from Bulgarians, from Romanians, and cross-border cooperation is my job, and we will see how to introduce it, that in 2018 it will be fully workable in all 27 member states.
Panie komisarzu, pan wspomniał o tym, że właśnie w jednych krajach te kolejki są dłuższe, w innych
You
są
mentioned
krótsze.
that in some countries the waiting list is longer, in others shorter. So let me ask, is it not so that in every country there's a certain percentage of people who are not satisfied with their healthcare service, and it's always an illusion that it's always better in another country, it's always better outside of Poland?
Yes, of course, it is an illusion. Because in all countries you have different problems and different shortages. One problems are in UK, another in Lithuania, third problems are in Poland. But satisfaction also is under monitor. And sorry to say, but in Poland, satisfaction is very low. I don't know why.
Może tak jak z tym pytaniem, panie komisarzu.
Like with the question whether our voice is heard, everybody is always unhappy, but they don't speak out.
Yes, but you know, but it's very good to see today opportunity to discuss those questions openly and to exchange our views, because it is only one way to see where we have weaknesses in our healthcare system here in Poland, where we have weaknesses in our healthcare system in Lithuania, in UK, in France, everywhere. A lot of problems, believe me. I am in my office alone 2.5 years. I am from Lithuania, I'm a medical doctor, but today I am commissioner. It's a miracle for me, because I never thought about such opportunity to be commissioner. And today I'm responsible to solve those issues together, but together with you, together with your government, together with Lithuanian government. And today discussions helps us to understand where is the weaknesses in Polish healthcare system. And I will ask Konstantin Radziwiłł to discuss those issues together with me, because they have national healthcare program and those plans how to implement. but we will help to achieve better results. And today's issue, today's hospital here, also is good opportunity to see possibilities to achieve specialized care here in Toruń after 2-3 years, because we will finish our project in 2019, yes? It will be good opportunity to change situation.
I właśnie pytanie dokładnie w tej sprawie od pani Katarzyny.
And a question from Katarzyna from Toruń, sent by #EU-Dialogue. A question to the Marshal. After the modernization of the hospital in Toruń, will the waiting list to specialists be shortened? As the Commissioner mentioned, the waiting list depends on the system in which we operate. Our objective in building the hospital is not to equip it with golden doorknobs, but to equip it with such instruments and devices that will ensure better patient care, faster, more effective, and more professional. Let me give you an example. All of us, in one breath, when we speak about models, we speak about Scandinavian countries, thinking that Scandinavian countries have a well-functioning system, including a well-functioning healthcare system. But that is not the case. In Finland, there are no waiting lists to see a specialist. In Norway, the situation is improving, but it's still a long waiting list to see a specialist in Sweden. So it all really depends on the organization of the healthcare system, not only at the inpatient level, but at the primary healthcare level. In Poland, we still do not have an integrated healthcare system. The family doctor, the GP, doesn't work with specialists, and the specialists don't work with hospitals. Then patients are treated as objects and not as subjects. We need to change this, and the idea, as the Commissioner said, to build a pilot program in, for example, Poland, if the system doesn't get improved, so that in Toruń we can build this integrated healthcare. We have already built the first step by creating infrastructure. Of course, Toruń is just a small part of the project. We are also upgrading other hospitals, county-level hospitals, as well as private hospitals which work at the county level. And now we need to take the next step to integrate the system into a coordinated entity so that the primary healthcare can cooperate with the specialist and the hospital. If we work out a system, we will be able to reduce the waiting list to receive inpatient treatment in hospitals. I'm certain that this will happen because the conditions in which the hospital works, we can look at the different departments, the ER and other admission rooms in the hospitals, the outpatient clinics in the hospital. Well, in the way they work today, we still cannot improve efficiency. I see another question from the room. Could you please use a microphone? Oh, madam. Oh, yes. Good afternoon. My name is I'm an neonatological doctor from the Provincial Polyclinical Hospital in Toruń, the breast milk bank. Breastfeeding, natural feeding of infants and small children, especially preemies and young children. This is a scientifically proven medical intervention. I know that this is the original prevention for many somatic disease, but also psychiatric ailments. So this is a prevention for children, but also for moms that breastfeed. Outlays are not really needed, not any major amounts, but some outlays are needed. In this region, we have excellent experience in cooperation with the local administration. We were the first in Poland to have the regional bank of breast milk created in the Voivodeship in the Provincial Polyclinical Hospital together with a foundation. And my question, And does the European Union, or can the European Union, support such measures with a clear message, namely that investing in such banks of breast milk is a valuable initiative, because we will be able to shorten a waiting list, because there will be fewer people with various civilizational diseases. I ask this question not only on behalf of people who in Poland are dealing with infant nutrition and lactation, but also on behalf of my colleagues from the European Union, from other countries. We recently met in Geneva during the initial initiative, a hospital friendly to children, and this was discussed. We do know that there's a certain conflict of interest. I do know that this is no easy matter, but if there could be a clear-cut message from the European Union, it would be easier for us to operate, and the doors would be open to us. Commissioner.
My personal clear message is welcome, because it's very nice example. Because it's prevention of breast cancer, it's prevention to have excellent babies. You know, my daughter, I have today only 3 grandchildren, 2 grandsons and 1 granddaughter. But my daughter has today's 3 months baby, and she is very happy to use breastfeeding, because absolutely, no doubt. And of course, no doubts about breast milk banks. We will see how to discuss those issues. But to provide assistance, financial assistance, it's very technical questions. We'll see how to encourage member states to cooperate, to present platform to establish, to support such bank. I will be more than happy to discuss those issues in more detail, because it's scientifically approved, no doubts. I know very well what does it mean, children-friendly hospitals we have in Lithuania. I was Minister of Health. I know very well. We developed such network, and those are standards and so on. Absolutely. It's a very good topic which we can to discuss together how to move in such direction.
Bardzo dziękuję, panie komisarzu. Kończymy pierwszą rundę pytań.
Commissioner, thank you. We are now completing the first round of questions. As you have heard, this theme of the extension and modernization of the hospital in Toruń has been mentioned many times. No wonder, it's a big opportunity for Toruń. Let us look now at who can apply for funding from the investment plan for Europe. Let us see the video. European Fund for Strategic Investment, it's a pillar of the investment plan for Europe. EFSI supports financially the project, which increases the number of investment projects and encourages the growth of the number of jobs. It's based on the system of guarantees and loans, which should make it possible to implement investment projects in the EU where they are most needed. The European Commission hopes that with the help of the EFSI, it will be easier to achieve the strategic goals, the union of capital markets and the digital Europe. Do you want to try? You can get advice at the national contact point or directly at the Bank Gospodarstwa Krajowego. It's also worth realizing that EU loans for investment can be combined with other forms of funding from the EU. Investment Plan for Europe, invest.eu. More information at europa.eu/invest.eu. Some practical information. Second round of questions that you can also ask via internet. Let us begin.
Czy ktoś z państwa tu w sali, w Toruniu, chciałby zadać pytanie?
Any questions here in Toruń? Please welcome. You're welcome. Please stand up so we can see you, sir.
Thank you very much for the possibility to ask a question. My name is Piotr and I represent Nicolaus Copernicus University. And I'd like to ask the Commissioner if there is a plan inside the health policy within the European Union to support the parenthood policy and to promote parenthood. Thank you.
Bardzo proszę.
Frankly speaking, I do not understand question of parenthood,
Czy
yes?
chciałby pan doprecyzować tak, aby pan komisarz lepiej pana...
Could you make your question more
Of course,
precise?
I've tried to make as short as possible the question. That's maybe the reason why it's not so easy to understand. The question is, if the European Union as the institution wish to promote the parenthood and support struggle against the demographic challenges within the Europe, and especially as you represent Lithuania as your national country, you understand how the problem is deeply influencing the roots of the society and also influencing the health policy and public policies related to healthcare, including the relationship between the elder people and the people before entering the market. So it also includes the quite significant financial issues of the future of Europe and countries and nations in Europe. So that's my question. When we discuss the dialogue on healthcare, there is a spot or area where the European Union might be involved in promoting parenthood?
Yes. Yes, and I understand your question. Okay. First of all, I would like to draw attention on very difficult situation when we are speaking about demographic decline in EU. In Lithuania, it's very tragic issue. It's sorry to say, but I am responsible also because I was Minister of Health, but we have segments. First of all, aging population, demographic decline. Second, minus, and minus, 10 or 20 years. Third, we have a lot of premature deaths, amenable and avoidable deaths. Every year in EU, we lost 1.5 million people because of amenable death. And of course, also possibilities to discuss demographic policies. But at EU level, it is very difficult to provide European Union demographic policy concept. Why? Because it is in the hands of member states. You mentioned a lot of factors, because it's not only about investment. It's about very complex issues compared with all infrastructure, kindergarten, possibilities to have credits, possibilities to have maternity, parental leave. We at EU level are in debates about parental leave, as you know. It's very sensitive question to achieve common understanding between 27 members on those difficult, sensitive questions. But generally, I will be more than happy to have more clear competencies that EU must also have their part of activities, changing situation compared to the demographic picture. But we will encourage member states to have their own national demographic plans with all compositions, which you mentioned, starting with financial instruments, taxation incentives, of course, dealing with infrastructure, which is very helpful if you have small children. You need to have kindergartens and so on and so on. And of course, finally, speaking about possibilities to provide more qualified health care and more qualified social care to those families, no doubts. And of course, also speaking about reproductive health, which is also in complex of demographic policy. And I will be more than happy to discuss those issues in more details with all governments. And of course, from EU side, we are in a way to support social development through European Social Fund, to helping in different segments, creating added value, which will help national governments to move in such direction. But of course, it is very complex question, and I will be more than happy to see more powers in Commission hand addressing those issues at EU level.
Bardzo dziękuję, panie komisarzu. Ja przypominam, że do państwa dyspozycji jest także pan marszałek. Proszę też o, widzę pan tak, już oddaję panu głos, pan już się zgłaszał. Może taka techniczna uwaga, żeby
Just a technical remark. During the response of any of the gentlemen, could you please signal that you want to ask a question by raising your hand? That will make our discussion easier. The gentleman.
About it because our GDP spending for the health system is one of the lowest in our union. The amount of doctors in Poland is the lowest right now in the whole European Union country. And I would like to ask you, does European Union has any political instruments to help us reach out to the minimum requirements proposed by WHO to maintain the health system? Can we make it better together?
Yes, we can. We can. But which instrument is today effective? European semester instrument, in which we are providing assistance and analyzing situation of macroeconomic imbalances, and of course addressing issues compared to healthcare system because of accessibility, sustainability, and resilience of healthcare systems is very important economic element. And if you read carefully our recommendations to Poland, you will see that we are providing signals in which areas Poland must change situation, because you are right, we know very well level of satisfaction, we know situation with healthcare doctors and nurses, but of course also you know very well that it is in hands of Polish parliament, Polish government, and Polish authorities to discuss those issues, because you have 3 levels of regulation: national health minister, national health insurance fund, and regional governments. They will discuss those issues together, how to change it, and we are ready to be part of those debates and to provide assistance, support, monitoring, and also to discuss how to implement in better way European semester recommendation in every country, and in Poland included.
Bardzo dziękuję. Panie Marszałku, pytanie do Pana od internautów, od Pani Teresy. Jakie działania na rzecz opieki
From Teresa, what activities for care of elderly people and making elderly people more active? What does the region do in this area? Currently, we focus on creating a better system of care in the home over elderly people, generally over people who require such care. there is a number of families that take care of elderly people, devoting their time to that, but they don't get any external support. What we would like to do is to help these families so that they can, it's usually the parents, for instance, go to work and change slightly the rhythm of their lives, which is very often very, very tiring because they often have been taking care of their parents at home for 10 years or even more. So that's the first idea, first project. We have funding from the European Social Fund to carry out these projects through powiat and municipality family support centers. This support has to be coordinated by various institutions. In addition, to make people who can leave home, who are in good health conditions, to make those people more active, we also have some European funding, like, for instance, for the third age universities or some other projects that can get support from these funds in different areas. We prepare those projects in order to use these elderly people to help us develop, to help us promote economic growth. For instance, we can organize teams of retired teachers who give private lessons to students or pupils who need this additional help. And they do it in schools in which they used to teach. We can also support long lifetime learning of elderly people. We do that. Like elderly people, seniors learn new foreign languages, they learn how to use a computer, so they are active in different areas. Now, how can you get EU funding for this type of projects? If you want to know, please come to our office. We have people in our office who can help you, guide you through the procedure and help you get EU funding for projects like that. There are a lot of areas where you can get funding. But what is important is that the long-term care centers, we already now have a competition announced where we will be building a number of such centers in our region in order to extend our offer of long-term care services. We will also be supporting the creation of new hospital units that provide this type of care, as well as hospices. But before I give the floor to you, the lady first. Danuta Minewska. I'm an active senior in Wrocław, active senior citizen, and I'm joining now because the speaker has just mentioned elderly citizens. Yes, all the initiatives that you mentioned is something that we use. We take part in them, but going back to healthcare system, I'm not a doctor myself. I'm a patient because of my age. And I wanted to say one thing. When watching from my point of view the healthcare system, I noticed that we are sort of getting into procedures, provisions, different relationships. We, elderly people, what we need is simple help, simple assistance from the center that is closest to us. But unfortunately, we even know about cases when someone looking for help, standing just in front of a clinic, died because the doctor could not go out and provide first aid to such a person. So this is my question. Should the direction of treatment system go into be creating mechanisms and procedures, or perhaps the main role should be to provide first aid assistance to people who actually need the help? Thank you.
Of course, no doubts, absolutely. Now, for me, it will be very strange to see my colleagues who are not ready to take first aid. I can't imagine. Colleagues, you are in the room, please help me. I can't imagine, because by professional, behavior is absolutely, I can help immediately, something will happen here. No doubt, because I know, I trained myself to do it. I provide reanimation in plane, in train, in everywhere. It's absolutely, I can't accept it, because it's against our professional and moral attitude. But when you speak about assistance, very important question, because we need to understand that when we are speaking about long-term care, we must speak about long-term care and cure together. We will join our health budgets, social budgets, our local budgets, and of course also different instruments to cooperating together and to encouraging community to be a little bit more humanistic, to helping elderly people to achieve social assistance. I can't imagine. It's not about money, it's about humanism. And of course also, I know very well that we will see in Finland today they have very difficult reforms joining together social assistance, social care, and health care together. Of course, it's very, very difficult question, and they spent 3 years in big debates around all Finland, and today they are in a way to approve instruments joining all forces. And of course, also very important moment is here. It's electronic e-health. Can you imagine how many problems we can solve if we will provide possibilities to use different electronic platforms, assisting families, assisting people around, informing people about health status of those elderly, especially if they have Alzheimer, mental diseases, and so on. Sometimes, you know, we have a lot of e-health instruments. And here, investment in e-health, producing more and more equipments dedicated to elderly generation, is very big area of activity, and we need to do it. You know very well, today some economists use name silver economy. Silver economy. I am silver also. It means about those part of our society who are silver today, and about youngest who are not silver at the moment, but believe me, you will be in the future, no doubt. And of course, we need to understand how many additional jobs we can create using modern IT solutions, encouraging younger generation to look at it, and of course to be involved in those so-called silver economy areas, and provide more and more instruments, assist elderly generation. That is the solution. I will encourage you to draw attention on this area of activity. It's a lot of jobs. Don't leave Poland. Please stay here and please create a lot of possibilities to create assistance system to eldest generation.
Tak to potwornie przygnębiające, że są takie sytuacje, o których Pani wspomniała. Panie Marszałku, czy Pan ma tutaj jakąś refleksję i chciałby się z nią podzielić?
Bez wątpienia, kiedy mówiłem o tym, że o systemie, wcale nie miałem na myśli tylko procedury.
The procedures, because the procedures can be the best you can devise, or you can have the best equipped hospital, but if you don't have good doctors in those hospitals, no system will work properly. So what you need to do is you need to sort of refer to this good old school. We must remember that a doctor has to take an oath, a Hippocrates oath. This is not a profession like any other. This is something that this is a profession in which you must remember it's your role to provide assistance at any time in any situation. A doctor has to have the knowledge, has to be confident, has to look for new solutions, has to learn all the time. It's a lifelong learning profession, very responsible. So if someone fails to help the patient, perhaps such a person shouldn't be a doctor anymore. The gentleman wanted to ask a question. Before that person gets the mic, a question from Kamila via internet. The obligatory vaccinations in Poland, can we force parents and fine them if they just in a justified way refuse to vaccinate their children? I think this justified is an important word here because this may be a controversial issue.
Okay. It's very controversial, of course. But personally, I am in favor to support mandatory vaccination in some very concrete diseases. Because it is absolutely unacceptable today, in 21st century, in EU, see that children are died because of they are not vaccinated from measles. Can you imagine? And those anti-vaxxers, they create a lot of problems. I don't know why, that especially in social media, I am so openly, I spoke in every event, very openly. It's absolutely, it's absolutely against science to act against vaccines. Vaccines works and saves our lives. It is crystal clear message. But when you ask us to provide, to provide some, to karać ich, to nie wiem, jak to zrobić. You have different picture in EU. In 16 countries, you have obligatory vaccination from some diseases. In others, you have voluntary. And of course, in some countries, you have very high level of coverage of vaccines, till 98%. In some, you have 95%. Doesn't matter that you have mandatory vaccination. Romania, for example, today has big difficulties with measles outbreak. Very big difficulties. And of course, it will be good to once again discuss those issues together, how to join our forces and create real, awareness campaign about situation, change such behavior to be resistant against vaccination. Because it's very, very dangerous. Of course, those people who are staying in environment in which we are vaccinated, 100 people are vaccinated and 2 not. Those 2 are safe. Why? Because we are helping them to stay safe, because we are not transmitting infectious diseases. And they don't understand, okay, maybe I am not responsible, I can live without vaccines. I vaccinate myself every year against influenza, for example, every year. And I did it last year together with Konstantin Radziwiłł here in Poland, in Warsaw, publicly, to promoting once again that vaccinations against influenza, because it helps elderly society to stay in better shape. And I will do the same, and we will organize this week big conference between different specialists in Brussels about vaccination and how to address those issues with, compared to those who are not ready to vaccinate themselves. Hesitancy is a big problem today. But I ask all governments, all parliaments to be very active, to show political and personal responsibility that we will change the situation. But how to punish them, I don't know. It's of course, it's up to national legislators to discuss those issues, but it's very difficult. When you are speaking of punishment, it's very difficult question.
Bardzo dziękuję, panie komisarzu. I teraz proszę o zabranie głosu pana, który już od dłuższego
czasu. Now the gentleman who has been waiting to ask the question.
My previous speakers have started a very interesting debate about the demographic issue. So my question to Mr. Commissioner is, how does the European Union intend to eliminate or level the social inequalities in access to healthcare for elderly people in member countries? Thank you.
Your question is very brilliant one, very difficult one. Frankly speaking, this question is everywhere. Today we have social inequalities and social determinants on the ground in every country. And after 2008, if you look at our analysis, we presented a health at a glance in EU in 27 member states last December, showing what does it mean health in social determinants in health. And it shows very bad picture. Poorest part of society goes in poorest health. And it means that we need to ask all of us how to provide social instruments, taxation instruments, accessibility to healthcare instruments, how to create integrated healthcare systems, how to address issues compared to poorest part of society because they are using less quality of food, they are less educated, they smoke much more, they drink alcohol more, and they see better, bad situation in their health. And how to also use public health instruments helping those poorest part of society to stay healthy. It's a very complex question. But it is really very, very important. Why we enshrine in our European Union a reflection paper on social dimension. Please read it. It's a very important report. Please look at those. And of course, in our social pillar, we enshrined also health indicators. First time in EU, encouraging member states to compare situation and draw attention on such situation about when we are speaking about social inequality today in Europe. We have, a lot of challenges and social inequality, one of the biggest challenges. But of course, it's not only in the hands of health ministers or social ministers, in the hands of all governments. Because you need to create very comprehensive picture of different instruments, helping those in need to have more support. Of course, it's also crisis of solidarity in society. Today we see crisis of solidarity, no doubt. And when we are speaking about European Union cohesion, about possibilities to see, how to act together, you see a lot of different voices. Oh no, European Union is only single market. We can, please don't care about because it's in hands of member states. We are not ready to provide more power to Commission because it's up to member states. It's very important also to blame Brussels. It's an excellent game. Sorry to say, but this game in Poland is very popular also. To blame something Brussels. Really speaking, I don't know what does it mean Brussels, because I am from Vilnius. Elżbieta Bienkowska, she is from Katowice. And we know very well that we are all the ordinary citizens like you. But we have possibilities to use those instruments which are enshrined in the Lisbon Treaty and to discuss those issues. But if countries not follow Lisbon Treaty, you know what, we have dispute with government about constitutional court. We have that dispute. Why? Because it's about rule of law. It's about democracy. It's not about Brussels. I don't know what does it mean. It's about our reality to follow rule of law everywhere. Here in Toruń, in Vilnius, in Madrid, everywhere. Otherwise, we have no chance to be as cohesion union. And of course, your question is a very excellent one.
Ważne słowa, panie komisarzu, bardzo dziękujemy. Teraz czas na pytanie.
And now time for a question that came to us through the internet. And at the same time, please raise a hand if you want another question. Marta, it was possible to get funding for the hospital in Toruń. What are further plans for the improvement of healthcare in the region, and will it possible to use EU funding for that? The question to the Marshal. We are thinking about what we will be doing after 2020, because the EU funding that we've already received for this financial perspective, that is the funds that we will have to spend by 2020, we have already allocated what was for the healthcare. What next? Well, I think that the program of improvement, infrastructure improvement of our hospitals, we will complete that program by 2020. Not only with respect to Voivodeship hospitals, but also powiat level hospitals and teaching hospitals. And I believe that the standard of those hospitals will be quite decent, but we are still thinking, and I think that with the Commissioner we will go back to this discussion, how to improve accessibility of healthcare system, how to build a pilot system that would use not just the Juncker plan and the strategic investment funds. The European Fund of Strategic Investment is not subsidies, it's the money that we will have to give back, pay back. The terms of those loans are very good. The European Commission takes responsibility for the repayment of this debt, but we will have to pay this money back, so it's not this easy money. But what we want to do is to get some other instruments. For instance, the European Social Fund is also a source that we haven't tapped on in full, particularly with reference to healthcare. I think that in every good hospital in the region where we have a good medical staff, the staff with research interests, where we have teaching hospital departments, they should try to create like research and development units where they could carry out research on issues that the hospital is interested in, but that those units be combined into a network of centers that cooperate with each other and all together implement some strategic research project for the entire European Union. So we are now talking about funds that support science, and then from science it's very close to business, to pharmaceutical industry. Medicine is great business. It's not an accident that in the US, for instance, or other well-developed countries, percentage-wise, the highest, much more is spent on the so-called medicine, healthcare. The higher proportion of GDP is spent on those purposes than in less developed countries. Here we still don't have enough business focused on healthcare and on medicine. This is a question to all Central European countries that are still getting out of the old system, and what we need to learn is to compete with countries such as France, for instance. Perhaps compete is not a very good word. Work together to be competitive as a continent vis-à-vis the rest of the world. So there are a number of such opportunities. It's a good question. Yes, I think the question to the Commissioner from Marcin earlier, why do you say 10, not 15 years for extending glyphosate?
Yes, Szanowny Marcin, I know, because this question is always on the screen. But I don't know how many people here are farmers, because this question for farmers side about glyphosate. Why Commission proposed 10 years? Szanowny Marcin, it's not standard 15 years, no. In law it is right that Commission will decide to prolong use of glyphosate till 15 years, not sharp 15, but till. It means that we will discuss those issues together with member states because of European Parliament decided to ask Commission to prolong use of glyphosate only 7 years. And we will see which compromise must be suitable to achieve qualified majority and to also send message to our industry that we need to see new types of herbicides, new types of low risk of pesticides, new types of biopesticides, not only staying with glyphosate. Glyphosate is safe, as science said. It's not carcinogenic, not mutagenic, and not affecting human reproductive health. Okay, but it means that we have possibilities to provide sustainable use of pesticides doctrine, encouraging use low-risk pesticides and other issues. And 10 years is very balanced approach.
Bardzo dziękuję, panie komisarzu. Teraz pani, która już się zgłaszała wcześniej, bardzo proszę. I jednocześnie proszę o sygnalizowanie kolejnych pytań, bo powoli zbliżamy się do końca.
Who signaled how will to ask a question, please raise a hand again. Only few questions will be taken because we don't have much time left, so try. Sofia Wałęga, University of Third Age in Racibórz. I wanted to ask a question related to the investment plan in healthcare for Europe. Because we're talking about treatment, about hospitals. Now, how about a healthy person? And what about prevention? Do we have anything related to those issues in the investment plan for Europe? And also another thing, which is the genetically modified organisms. How does that relate to the investment plan?
Thanks a lot. Because of general rule is, and you agree all with me, prevention is better than cure. Yes? Prevention is better than cure. All know very well. But when you look at countries' budgets, you see strange figure. That in prevention, they dedicated 1%, 3% of GDP. Because of mostly they are invested into health care, into institutional issues. Why? Because understanding is very strange. And of course, Commission asks countries to draw attention on prevention, promotion, and protection instruments and provide to Commission so-called national health plans in which you can introduce many public health instruments and ask Commission to support, to finance those instruments. I know, because from my point of view, when I was Minister of Health, we provide to our Commission to help us invest more money in preventative public health instruments. And we achieved something in this area. I don't know, maybe the same is done in Poland, but because I know that Poland decided to raise level of finance into healthcare system, but I do not see today's final situation about how many money Poland is dedicated to provide into preventative, promotive measures, but I think I absolutely agree with you. We are ready to encourage countries once again to draw more attention on prevention. Sometimes prevention needs zero money, absolutely. Can you imagine smoking situation in Poland? It's not so difficult to raise hands in your national parliament and to provide law against tobacco use in public spaces, to guarantee more free spaces without smoke. It's difficult? No. But can you imagine how it's difficult to achieve positive result at parliament level? Why? Because of lobby. A lot of lobby. And we will see very well the picture. And when we are speaking about prevention, a lot of measures regulating sugar, salt, alcohol, tobacco, and of noise, air conditions. A lot of measures now need nothing except political will. I encourage society to follow my advice and to debate those issues and to achieve more healthy environment. Otherwise, our prevention measures will be very weak. Do you agree with me? Okay.
Bardzo dziękuję, panie komisarzu. Pan, bardzo proszę, pan się zgłaszał. Proszę o przekazanie
About GMO, the second question.
GMO, tak
Second,
jest.
GMO, also
Żywność genetycznie
very important question. But science is very clear. EFSA provides very clear scientific assessment. GM crops are safe and not creates problems to health. It's scientific approach. But I know that in society, public opinion is very much against. When Copernicus decided, and this Copernicus assessed that it's a heliocentric system, he was very worried to present such his scientific discovery to society. Why? Because he knows what was with Galileo. You know very well that it was so because at that moment public opinion was very against. And today we have a lot strange situation when science provides real facts, but public opinion is against. But you know, we will follow science. I am obliged to follow science. And of course, when we authorized GM for feeding animals, it is safe product for feeding animals.
Bardzo dziękuję, panie komisarzu, i pan, bardzo proszę pan od dłuższego czasu. Czekaj, to już niestety będzie ostatnie pytanie podczas tej
Will
debaty.
be the final question in our debate.
Two different towns, 100 kilometers, can change many in medical care's level, and many of us need to travel perhaps for surgery to another town, and that cost, of course.
Sorry to say, if I correctly understood your question, it will be difficult to imagine that you will have all modern surgery departments in every city. Sorry to say, it is impossible. And then, you know, you always must see systematic in which city you will have very high specialized hospitals, in which you will have qualified healthcare system, and in which place you must have primary healthcare. And only systematic approach can help address those questions. If you are speaking about cross-border situations, in some areas you have a situation when people are staying in Poland, but hospital is in Germany, very close to people. I would like to draw attention, today we have European cross-border healthcare directive, which allow patients to go to the cross-border and to receive treatment in Germany, but in only one way, to communicate with national contact point and then to see how to encourage government to reimburse cost of treatment. But such possibility is today on the ground. Speaking about internal situation, yes, of course, you must develop comprehensive territorial systematic plan how to deal with specialized, especially with specialized medical care, because it's impossible to have specialized care in every city.
Bardzo dziękuję, panie komisarzu. Jak wspomniałam, to już było ostatnie pytanie, które mogliśmy dzisiaj zadać podczas tej debaty. Jeśli państwo mają kolejne,
This was the final question that we could ask in this debate. If you have other questions, please transmit it to the Commission Representative Office. Now let me invite the Marshal to sum up our debate. What was inspiring to you in today's debate, Marshal? Ladies and gentlemen, allow me for briefly to stand up. What was truly fascinating for me was the dynamic manner in which the Commissioner responded to the questions. He expressed his outlooks in a very dynamic way, but also I was impressed by his enthusiasm and trust and confidence in the future of Europe. But let me say the following. I do believe that all of us share this sentiment, this opinion, that healthcare is a good, sound investment, investment in Europe. And the fact that a plan for investing in health in Europe will be developed will mean that this will translate into economic growth. I do believe that all the questions that were raised by you, ladies and gentlemen, today can be broken down into two areas. Those that pertain to the local community or regional dimension. And these are things that we need to tackle ourselves. And this is within the prerogatives of the domestic parliaments. Many questions of this nature need to be answered by us in the local authorities, but also in the national parliament. But there were also many other questions that I think can be of inspiration to the European Commission to take more bold decisions in the future in terms of a cohesion policy. You cannot be fully European if you only just open up borders and if there's only free movement of people. What we need to do, we need to open up other barriers, open up gateways that will create equal foothold in terms of access to medicine and healthcare. So this is a dimension that needs to be harmonized throughout the European Union. What we need is a new plan, a plan for the future. After 2020, when we implement the next financial perspective, we need to move away from a form of thinking where we believe that healthcare is just a social dimension that should not be invested in. Because sometimes, and this is the case today, when I meet with the Commissioner for Regional Development, which looks at various economic parameters. It's difficult to put in this debate debate on healthcare when this commissioner needs to do away with unemployment and create a level playing field in terms of incomes. So it's what those areas that she looks at for are mainly roads and the so-called hard infrastructure. But I believe that there's other fields of our operation and activity that need to be taken into account. And many of you in your questions related to this softer dimension. Of course, many of the questions pertained to waiting lists. When can we feel that whenever we fall ill, we will be able to receive the proper treatment from a skilled doctor, be it at the primary healthcare level or a specialist. So I do believe that there are various recommendations of what needs to be changed in Europe and what needs to be changed in Poland. However, without increasing the amounts for healthcare, and I'm not speaking here only about specific numbers, amount, but also the share of GDP. Without a higher share of GDP, this cannot really be addressed. Many of you ask also about prevention, starting with breastfeeding all the way up to prevention. I do believe that prevention is really the best safeguard. If we create a system, we need to understand that many physicians will not need medical intervention if ahead of time we can create proper living conditions and the proper preventive measures, healthy lifestyles, healthy food, everything that makes us more resilient to disease. So I hope this system can be built. Well, one more to conclude, one more reflection. You are really fabulous for persevering with us for so long. The Commissioner is very open to also one-on-one and taking photos to speak to you on an individual basis. I think we have about 30 minutes for that. So all of you who are here with us via the internet, I would like to thank you for being with us. This dialogue had exceeded my expectations. Truly, very many people, young as well as the elderly, had been actively participating, all those who have the European Union and the future of Europe at heart. But if I may, Commissioner, some comments and reflections after this meeting. Is there anything new that you have heard? Something new compared to the other meetings you had in Europe?
Dziękuję bardzo. To jest jedno pytanie od Joanny. Czy komisja
Again, question from Joanna. Does the
jakoś
Commission or the EU in general can co-finance the reform of health care in the European Union countries? I think that yes, yes. Thank you. This was a very nice opportunity for me to talk to you, to listen to you. Thank you for the quality of my Polish, but I'm really glad that I can be here with you. And it would really be nice to meet again, to talk again, and then to think how we can improve the EU, make it better for everyone. Thank you very much. Thank you very much, and thank you, ladies and gentlemen. Thank you for the applause, for interesting questions and interesting discussion. But the last question is a question to you, question to the audience. We will vote in a similar way as in the previously by raising hands. Has the participation in the civil dialogue increased your knowledge about the European Union? Has this debate increased your knowledge about the European Union? If yes, please raise your hands. Yes, very good. Yes, I'm really glad to see that. So I probably won't ask who would say no, because it's minority. I'm really glad that we've managed to encourage you to speak up. And I think that now, if we asked you the first question, the initial question now, do you have a feeling that your voice is being heard in the EU? Because you have seen that your voice is being heard, that EU wants to talk to you. Just one more comment. There was a question, can we count on for further funding from the EU? I didn't want to answer because I wasn't sure, but now I know that yes, we can. Piotr Całbecki, the Marshal of Kuyavian-Pomeranian Voivodeship, thank you very much. And Vytenis Andriukaitis, the Commissioner of the European Union for Health and Food Safety. Thank you very much for this meeting.
Wszystkich Państwa chciałam jeszcze poprosić o pozostawienie zestawów słuchawkowych. Już tak, możemy się przemieszczać. Zapraszamy przede wszystkim na skromny poczęstunek. Tam też będzie